This is a very fascinating technology, and I think it's going to represent a paradigm shift in the world of medicine because it utilizes physical therapy instead of prescriptive medications to affect an outcome. These devices don't have any medicine on them. There's no contraindication to using them. They're these 2-inch by 2-inch little Band-Aid looking squares, and embedded in the glue of these adhesive patches is a texture. When that texture touches your skin, it sends a specific signal along the nerves of the skin to your brain to normalize a neurologic pathway in your brain. So each of these patches has a different signal, which means it affects a different part of the brain. And much like a QR code might direct you to a very specific website, each one of these patches is going to direct you to a very specific neurologic pathway. So the pathway that controls chronic pain is very different than the pathway that controls your ability to sleep or your anxiety or your mood or even your athletic ability. And so there are a variety of these patches. They're all considered FDA Class 1 medical devices, which means they're safe to use. You don't need any specific medical training to use them. And their function is more of a physical therapy as opposed to a medication. So you can use it regardless of the patient's age, what medicines they're on. There's really no contraindication to their use. And in my practice, I use them for the first one I was interested in actually was the pain one, because as a surgeon, I hurt people for a living. And so the first one that I was interested in was their Freedom Patch, which was for pain. But I found that my patients also benefit from being able to sleep when they're in the hospital, not having anxiety about having a surgery, increased balance, so maybe they're less likely to fall and hurt themselves. So I use a variety of these patches on a day-to-day basis with my own patients.